Hello everybody, my name is Marek Trneny. I'm based in Prague, Charles University General Hospital. I'm lymphoma guy and I'm very happy that I'm able to present on behalf of the whole team of investigators the INMIND study here at EHA in Milano. The INMIND study is focused on the patients who failed at least one therapy for follicular lymphoma, and the patients have been randomized to get the standard treatment, which consists of lenalidomide plus rituximab R square plus placebo versus experimental arm, which consists of the lenalidomide plus rituximab R square plus tafasitamab. This study randomized almost 550 patients, and the patients were equally distributed among the both arms. The primary endpoint was a progression-free survival assessed by the investigator, and the study met its primary endpoint, which is progression-free survival for follicular lymphoma patients. And in experimental arm, there was a 57% risk reduction of dying or progression. The median progression-free survival was 14 months for the standard arm and 22 months for the experimental arm. This analysis, these data have been confirmed by the independent review committee, which found the risk reduction by 59%, hazard ratio 0.41, and the median progression-free survival for experimental arm was not reached compared to the 16 months for the control arm. There have been several important secondary endpoints, including the time to the next treatment, including the complete metabolic remission rate, which was significantly improved from 40% to 49% control arm versus experimental arm, as well as overall response rate, which was significantly improved as well. Very important point in our analysis is the pre-planned subset analysis. And the study was stratified according to the POD24, the number of the previous line, and the rituximab refractoriness. And in all three pre-planned sub-analyses, it has been shown that there is significant improvement for the experimental arm. Okay, I should not say significant because it's not planned to be significant, but there is improvement for POD24 refractory, rituximab refractory patient, as for the patients with a higher number of the previous line, as well as in the other subsets. The toxicity was slightly higher, but it was not statistically significant in some points, but there was manageable. And currently, we can consider that this combination, R square plus tafasitamab, could be considered as a new standard of the therapy for relapsed refractory follicular lymphoma patients. And it's important because it's solely the immunotherapy which targets both antigens CD19 and CD20 together with immunomodulating drug lenalidomide. Thank you so much.